Today, I am going to have a conversation with you about our sex drives. We're going to have this conversation because it's usually skipped during your visit with your provider. We don't want to keep skipping it because good sexual health is part of good health. I'm Chelsea. I am a family nurse practitioner and the founder of Orchid Wellness. Orchid Wellness is a primary care and wellness clinic in the DFW area. We provide care for all ages from newborn and up. We also provide telehealth across Texas, New York, Virginia, and DC. So our tagline is complete care for you, with you, because we work with our patients to give them complete care. All right, all done with that. So sexual health is part of good health. It is part of overall health. Full stop. It's not a luxury conversation. It's not something to be embarrassed about. It's not something that you should kind of be used as a doorknobber. When you're leaving the provider's office, you'll be like, oh, something that I just forgot. Everything is not like working the way it used to. That is not the way sexual health should be treated. It should be treated with the same amount of seriousness that we treat all other healthcare issues. In my practice, I treat sexual health with all the clinical seriousness that I treat all the other systems, because that is exactly what it deserves. Let's start with a reframe, because I think the way that we have been thinking about sexual health is not the right way. Let's start with thinking about it as part of our regular health, first of all. And then also, most people think about it, we approach it as something that is already working against us, right? When libido changes, the first place that people usually go to is blame. They blame themselves, they blame their partner, they blame their age, and then quietly decide that that's just how it's going to be. And that's just not how it's supposed to be. That's the wrong conclusion. A change in sexual desire, function, or satisfaction is a clinical sign. It belongs in the same category as weight changes, mood changes, chronic fatigue, blood in your urine. That's your body communicating to you that there's something going on, and it is our job to listen to that. I see this a lot with patients when they just come in, they're like, oh, my libido, or there's something going on, like, I feel like this store is completely closed. I'm not interested at all. If my husband comes next to me, I'm like, whoa, buddy, hold on with that. And all of that is, they're medical conversations that we need to have. They deserve direct medical attention, because when sexual health is poor, it means you have poor health. Okay. Let's talk about what's actually happening in the body when this happens. Your hormones take care of everything in regards to sexual health. And when they are balanced, then things tend to work well. And then when they're off, things are off. So for women, estrogen, progesterone, and testosterone are the primary hormones. Estrogen maintains health and sensitivity to the vaginal tissue. That's why when women go into menopause, they tend to have pain with sex, because estrogen is reduced and there's not enough lubrication, and that causes more increased frictional tears, and that can cause pain. So when this drops, sex can become uncomfortable or painful, and the nervous system will associate pain with sex, and then so they're not in the mood. Okay. Progesterone affects the emotional part of it, and it's the emotional baseline. So when progesterone is off, sex is also off. And testosterone drives desire directly, so that spontaneous wanting, that's testosterone. And when testosterone is low in a woman, that feeling can disappear almost completely. And most providers don't even check for testosterone in women, because we usually equate testosterone to men. And when it comes to women, we're not thinking of testosterone, we're just thinking estrogen. For men, testosterone is very central. It drives libido, energy, confidence, erectile function. But testosterone is not the only picture for men. Estrogen matters in men as well. Thyroid function matters, cortisol matters. And I see that in men, testosterone can come back in normal range on paper, but they still have the symptoms of deficiencies because they're free testosterone. That's the biological active portion is suppressed by other factors. For everyone, cortisol can affect general sexual function, right? Because cortisol is a stress hormone. It overrides everything. When your body is under chronic stress, it does not prioritize reproduction and desire because your body is thinking about, let's keep you alive, right? Not thinking about your sexual function at that time. And that is not a personal failure on your part. It's just biology. It's just science. It's just the body's doing what it's supposed to do. But it can also a situation whereby it can increase your stress because you're feeling like, I'm way more stressed. I don't have any sexual desires. My libido is down, and it's causing more stress. And so you get into that vicious cycle, and that is not helpful. And that's why hormone replacement therapy, when it is individualized, when it is properly managed clinically, can be genuinely life-changing for the patient. Not just for how you feel on a day-to-day, but also how you feel in your relationship and in your body. Okay, there is a lot of research that has gone into hormone replacement therapy, and some of the research has said that it is not, safe for women, but science is becoming more and more up to date. Research is changing, that conversation is changing, and we are having more conversations about hormones. How do I assess sexual function in a patient? Usually it starts like this. I usually get the door knocker conversations where the patient is about to leave and they're like, one more thing. That's usually how it works. I have learned to now ask it as part of my SWANS conversation. SWAN stands for sleep, water, activity, nutrition, and stress management. My part of it is your ownership. That is my trademark framework of wellness. During my SWANS assessment, I integrate sexual health in the stress management part of it. I always ask a patient, how is your libido? How is your sexual health? I start listening to the whole picture. At this point, I've usually gone through the My Swans with the patient, asking them about their sleep, asking them about their water intake, asking about activity, asking about nutrition, asking about what the biggest source of their stress is, how they're managing that stress, and then we talk about libido. By this point, I've gotten the whole picture. I can kind of assess the patient as a whole. And I ask questions like, how did this change? When did it change? What is the biggest thing that you noticed that gave you the alarm, like, oh, wait, there's something wrong? Was there a trigger? Did something happen health-wise, medication-wise, a major shift in lifestyle? And with these conversations, I start getting my light bulb moments like, oh, this might be the culprit, or that might be the culprit. I ask about medications that may not have been on the patient's med list, because medications like antidepressants and blood pressure medications, some contraceptives, and even some supplements can affect libido. And then we go through a lab panel just to check everything to see what's going on. We check testosterone, estradiol, progesterone, DHEA, thyroid function. We do a metabolic panel, inflammatory markers, because I want to see clinically what's going on with the patient, in addition to the human stuff that the patient has given me, because some of the things is only going to come from the patient. It doesn't matter what test I do, I'm not going to get that information. But after talking to the patient, we do some blood work, and this is the best part of what I do is you treat the human and you treat the patient, and you put it all together, and it meshes so beautifully, and you have a really good picture that you can look at and figure out what is going on with your patient. Okay. Mental health concerns like anxiety, depression, unprocessed stress, complex PTSD, or just PTSD by itself, these are not separate from conversations about sexual health, because they can really, really affect sexual health. What are some of the common causes of low libido? The hormonal decline, obviously, that is usually the first thing. A lot of people come into the clinic because they're having changes in hormones that definitely they feel like a conversation needs to be had. Menopause, andropause, postpartum, post-surgical hormonal shifts. And during those times, there are changes in testosterone, estrogen, and it affects both men and women. That's usually when I see people have conversations about sexual health, because those causes have caused changes in hormones. Another thing is medication. SSRIs, SNRIs, antihypertensives, contraceptives, they can change your libido because they do affect your hormones. It doesn't mean that you should stop taking them. It just means that you should talk to your provider about finding what the sweet spot for you would be. I always say that good health is health that is beneficial to you. If the medication is treating your symptoms but it's causing a decrease in your quality of life, then this is a medication that is inappropriate for you. You need to work with your provider to find a medication that will solve the problem and also make sure that your sexual health is where it needs to be. Chronic stress and elevated cortisol levels are another big indicator and cause of low libido. Your body cannot be in fight or flight mode, also be thinking about sexual health. Think of you in a battlefield. You are protecting your life and the life of the people around you. That's not the place that you're going to be worried about your sexual health. It's just not the way the body works. So when cortisol is chronically high, your body is chronically trying to protect itself. So sexual health is decreased. That's the way it works. Another thing is sleep. Now, sleep deprivation or sleeping where you're not getting restful sleep can definitely affect sexual health. When sleep is reduced, it affects testosterone. Like we already said, testosterone is the one that's bringing you in the mood. When sleep affects testosterone, that means that also affects your sexual health. Now, your hormones do repair and regulate during sleep. So if you're not having good quality sleep, again, that's going to affect your sexual health. Your cardiovascular health is another cause. If you think about it, sexual health has primary with blood flow, especially in men, in women as well, especially in men. If cardiovascular health is not where it needs to be, then sexual health is not going to be where it needs to be. That's when we see things like erectile dysfunction, inability to hold an erection, just when blood vessels are not able to dilate the way they need to dilate. That means that an erection cannot be held or cannot be sustained. That can cause problems in libido, sexual health, increase in stress. Then that can cause issues and decrease the sexual health. Relationship and emotional factors, like if the desire is not there, if you're not attracted to the person, if the person makes you feel off, if you're feeling upset with the person, then the desire is not there. That's when the biology and the emotion intersect. When those two things are not connected, we cannot have good sexual health. It's both clinical and human. Those are very important. That's very real. Both of them should be taken seriously. That means you should not be in a relationship in which you're not fulfilled, because that is going to affect your sexual health. Nutrition. Now, zinc, vitamin D, magnesium, they all play a role in hormone production and in sexual function. A lot of people have low vitamin D. In my career, in the amount of time that I've been a nurse practitioner, I've only seen 2 patients that have a vitamin D level that is too high. Typically, most patients have really low vitamin D or low normal vitamin D. I usually want my patients to be between 50 and 70 for vitamin D. The normal range for vitamin D, the lab interval range, is between 30 to 100. 50 to 70 is where I feel like most patients do pretty good at. If you have chronic low vitamin D, make sure you pick up a prescription from your provider or a supplement over the counter so you can take that. All right. How does Orchid Wellness help with sexual health? What can we really do about it? What can Orchid Wellness, what can I as your provider, what can your provider, wherever they are, do about your sexual health. Here at Orchid Wellness, we offer hormone replacement therapy that is supposed to help our patients with their sexual health. It's not just me giving you the hormones just because I want you to have good sexual health. It is a very comprehensive conversation because I need to figure out where biology and humanity meet so that we can solve the problem on both ends of the spectrum. Hormone replacement therapy are for patients whose labs and symptoms point to hormonal deficiencies that can be resolved by replacing those hormones. HRT is often most impactful starting point because we individualize every protocol for the patient based on your labs, your history, your symptoms, and your goals. And this is not a one size fit all because our hormones are not the same. If you put 100 people in the same room and you check our hormones, everybody's going to have different hormone levels because we are so unique when it comes to our hormones. That is one of the ways that we treat sexual dysfunction at Orchid Wellness. One of the other ways is a sexual wellness stack. This is a compounded prescription that combines 3 clinically selected compounds targeting all the 3 dimensions of sexual health. We have in it PT-141, which works at the brain level, activating the pathways that takes care of sexual desire and arousal directly. Oxytocin, that deepens the emotional connection and enhances sensation. It works first at the brain level. It works at the emotional connection level. Tadalafil, which also increases blood flow. Now, we talked about this already, that blood flow is important because it helps with erection, being able to hold an erection. Also for women, just flooding the vaginal area with proper sensations so that a person is able to enjoy sex. With our sexual wellness stack, we are able to fine tune it based on the patient to be able to provide them with a solution that will work for multiple options based on the human and the clinical so that they can mesh together and be the kind of care that the patient needs. Also, we look at your thyroid and your metabolic function, make sure that that is not detracting from the work that we're doing with the sexual function. We also do a very intensive sexual screening, including a cardiovascular screening, making sure that your cardiovascular health is where it needs to be. We check the autonomic nervous system, a sympathetic nervous system. We do blood pressure, obviously. We check the cholesterol levels because all of these things gives us an idea of what is going on the cardiovascular end so that we are not just putting band-aids on things, that we're actually solving the problems at the root cause level. Also, there's mental health. If you are my patient or you've come into contact with me, you know I am a big advocate for mental health. We work with a lot of therapists and psychiatric mental health providers to help treat our patients for anxiety, depression, relational stress that can contribute to sexual health. We collaborated with all these providers to make sure that in solving all the other problems, we also are able to solve sexual health problems for our patients. Now, with all of these combining, we also have the conversation. Sometimes patients just need somebody to listen and try to just figure it out with them. So this is just a troubleshooting. We troubleshoot with the patient. We listen to everything. Then we take everything that the patient has told us in little bits and solve all those little bit problems at the root cause of it. And then we bring it together. And then we monitor to see what the results will be. Now, here is what I want you to walk away with from today. Your sexual health is part of your health. It's not a bonus. It's not a luxury. It's not something to revisit when everything else is figured out. It's a key part of your health. It belongs in your annual wellness conversation. If your provider doesn't bring it up, please bring it up, because the same way your blood pressure, your blood sugar, your weight, your cholesterol is part of your wellness, your sexual health is part of your wellness. If something has changed, your provider is not going to know if it doesn't have a physical indicator in your labs or something like that. It is up to you to bring it up in the conversation so they can know. You deserve that level of care, the care that is complete, that looks at you as a whole person, not just parts. If you are in Texas, if you're in New York, if you're in Virginia, if you're in DC, and you would like to get that Orchid Wellness care, that complete care that is for you and with you, then send me a message at myorchidwellness.com. You can book an appointment with me at myorchidwellness.com or telehealth.myorchidwellness.com. If you're in the Dallas to Fort Worth area, you can come see me at the clinic in Carrollton, Texas. Share this video with someone who needs to hear it. Share this with your family, with your friends, because remember, good sexual health is part of good health.